So give me a review then of the services and products that you offer, that you give the dentist.
Yes. Randy, one of the things that I give the dentist that is the cornerstone of medical emergency mastery is a well-constructed medical history form. I consider a well-constructed medical history form the most important tool that a dentist has.
Is this what they like the most, by the way, by any chance?
Let me tell you this. I think they like everything I do, but I like the medical history the best.
All right.
I like it because with a well-constructed medical history form, we can determine...
And this is computer-driven.
It
PDF.
is. Let me tell you this.
Okay.
With a well-constructed medical history form, we can decide what patients we want to invite to be members of our dental family.
All right.
Because our patients, we choose to be in our family. But with a poorly constructed medical history, our patients sometimes are in our family and they become part of a member of our family that we're not too sure we want to remember.
Okay.
So with a properly constructed medical history, and mine is driven by computers, so with a positive affirmative response, it continues to generate more and more questions. So the doctors don't have to continue to ask questions, think about questions, wonder, did I ask the next right question? After the patient completes the medical history, whether online, whether at a computer at your office, or whether they complete it online and mail it to you, you've made all your next right decisions. You can decide whether you do want to get more information from a physician or whether you want to think about it for a couple of days.
Okay.
So that's the first piece of information that you have. What I firmly believe is everything that you ever needed to know about the patient is lying in front of you on that piece of paper. So
Couldn't they argue, though, already our medical intake is so large and now it's even larger and may create more can of worms or more liability?
It's so interesting that you say that. That is the question that I hear, or the statement that I hear over and over again. But really think about this. How many questions are on the majority of the doctor's medical history? I've seen them. Not enough. I've seen some with as few.
How long does it take, by the way, with all these drop downs in the PDF?
That is such a good question.
I'm on a roll today with these questions.
And I like that. I took my test myself and had everyone in my family, because of course your family are always your sample population. It took me about 12 minutes.
Okay.
And think about how long it took the last time you went to your dentist. If you're sitting there manually filling it out, how long did it take you to do it? Took you about 12 minutes probably.
Okay.
You do it on the computer. And for your seniors that probably aren't as capable, someone can sit next to them. Now, that's going to take a lot longer.
It's computer driven, though.
Yes, it is. It's like in a PDF.
So
you're just going to touch it, and it's going to continue to do the drop downs and fill it out for you.
The patient is touching it, like on an iPad type of a screen?
They can do it on an iPad. They can click it on a computer. There's a variety of means of delivery.
You put the patient in front of a computer?
Yes.
Okay.
But let me tell you this, whether it takes 12 minutes or 14 minutes to do that, I reflect back on my patient. And those questions, if they were accurately asked and answered, would have prevented what led me to develop this system.
So does it have red flags that'll pop up for the doctor to say, hey, this person's at higher risk, or maybe you have to take a look at it?
Well, it takes you down through the sequence, and it actually will analyze it for you, and it'll help. It classifies your patients.
Oh, it classifies it.
Yes, and it will classify them in doctor language. It will classify them whether the patient is a candidate for routine treatment.
Okay, okay.
Now, I think this properly constructed medical history is worth everything. I would say that I would give this away if the doctors would purchase the rest of this.
So this is the most important part? Okay. And then the other services that you offer. Okay, so we've already talked about you go in there for a half day.
I guess you could tell I like that, yes.
The full day, train the staff, and then you give them a kit.
I do.
It has all of these dummied down medications, how to use it, what to do. You even did a sample on me. You handed it to me, and it is really easy. It's based on the problem they have. It's labeled.
Yes, this one's even easier. Let me see another
Okay,
one.
this one says fainting. Yeah.
And you just break it and wave it. Each one of these, a child on the street could do. And that's what I like about it the most, that even the doctor, if they are anxious, they could remember how to use this by looking at it.
Once they pay the initial for you to come there, what is the annual fee after that? Just for maintenance. How much is that?
$295.
So $295 a year. And I think what's nice is because, knowing that you were coming, people are saying, yeah, Randy, the big problem is the medications go, they expire or, things like that, but you notify them.
I do.
You send them automatically,
yes,
like an auto ship, that they keep that kit updated. Is that right?
It is,
And that's included in the price.
And
Okay.
just like we mentioned, should they use a drug, they just phone.
Okay.
And I send another drug out to them. And sometimes they inadvertently use a drug. So even if they don't have the emergency, if they think they have the emergency and they break open and they use it, not a problem either. So there's not a charge for that. And that's one of the things I love about it. I would rather my clients be using something inadvertently than use it erroneously. That's okay with me too. There's no charge for phone consultations if they have a question about anything, and then I routinely do follow-up. So I'll call the week after, 3 weeks after.
So the
and check.
office manager that's watching this, or the dentist, to get started, it's a free consultation on the phone to see if there's a fit.
Absolutely.
Right? And then what, you fly to them, go to them?
Yes, I do. I can fly to them. Most of the offices will want to combine, if there are multiple groups, they'll want to have either, sometimes they even have their colleagues join together for a larger group session. One of the things that we find is if there are multiple doctors practicing together, that they all will do the course at one time. I found that it's not as effective if there are 3 or 4 doctors practicing in the same office for them not to have the services rendered at the same time. The other thing I forgot to mention is for my new clients, along with the emergency drug kit, I'm giving them a comprehensive first aid kit, because one of the most recent things I've noticed is they have either a very poorly constructed or really an inadequate first aid kit. And some of the emergencies that I noticed they had were the garden variety. They had burns, or they had cuts, or just very unusual type of first aid emergencies. And I looked in their kits and they had a Band-Aid, or maybe some scissors, or just really poor things. And if you'll look on the list I gave you, I've pretty much covered it all. I've got aloe vera and eye wash, and just got all kinds of things. There's 42 components in that. And I thought that would just be a really nice little thank you gesture. So I started including that in what I brought to the offices. And that's just been a really nice little thank you to my clients.